Hi, I'm Jean Schumacher, founder of the Plant-Based Academy, where I provide help, support, guidance, and resources to switch to a plant-based lifestyle and get your health back. And today I have the privilege of connecting with Jenny Cameron, who's a nutritionist and runs seminars and immersion programs on focusing on plant-based nutrition and lifestyle. And with her is Dr. Malcolm Mackay, who is a general practitioner with more than 35 years of experience in medical practice and special interest in preventing, treating, and reversing chronic disease with whole food plant-based nutrition. And they are from Melbourne, Australia. So thank you so much for taking the time to be with me here today.
Thanks, Jean.
Yeah, thank you for having us on your podcast, Jean.
Well, share your story about what inspired you both to adopt a plant-based lifestyle and how has it influenced your practices?
Okay, well, of course, in medical school, we all learn about this. We don't really. But for me, it was about 2 or 3 years into medical school where there was one lecture about the inevitable process of atherosclerosis, I quote, of artery disease, and all the risk factors and some rather gruesome pictures of, heart attack hearts and damaged brains and gangrenous legs and things, rather gruesome. But then within the same semester, another lecturer told us that, well, there are people in other parts of the world, like in particular ones that I related to were the people of highland Papua New Guinea, who never got this inevitable process of coronary artery disease, similar to the people in rural Asia and rural China. And of course, when I looked at all the risk factors, they were all there. Like people in the Western world were all eating, all the meat and the fat and the salt and the sugar and the low fiber. And these people were in highland Papua New Guinea. It was, what's for lunch? Sweet potatoes. Like, what's for breakfast? Oh, maybe some sweet potato leaves as well. So at the time, I was had this, idea that I'd like to keep snow skiing and stay healthy all my life. And I was becoming a little bit competitive in distance running in Adelaide, Australia. So I thought, okay, I'm in on this. And so I changed my diet to try and sort of simulate the high fiber, low fat, low salt, more plant predominant or plant-based diet of these peoples. And I don't know why all my other colleagues didn't, or my other classmates didn't see this. It looked blindingly obvious. It seemed to work for me, certainly athletic-wise, maybe not socially. But I think later that year, I ran a 2:32 marathon, and then the following year, came first in one of our early local triathlons. Then I found Nathan Pritikin's books and became a bit of a Pritikin fan because, if you look at the Pritikin regression diet in its strictest form, it is like an SOS-free whole foods plant-based diet, more or less. So I was in on that. And when I graduated, went into general practice, I'd print out little book lists and hand out diet guides. And we had a Pritikin Health Association in Adelaide and potlucks and public. I would sometimes give the public talks. So that was my sort of kickstart to it all. Although a couple of years after graduating, I thought, I haven't really got a good grounding in nutrition, Nutrition 101, the basics. So I actually went back to university part-time. I did a graduate diploma in human nutrition. I'll fast forward to when I met Jenny Cameron. We both had teenage or young adult children from previous marriages, and we met on a chairlift at our local ski resort. Actually, someone introduced us. I think I credit Jenny with connecting me to, this was like 2008, 2009, with the growing US whole foods plant-based community that had been there in all little pieces, NHA, Pritikin, McDougall, Esselstyn for years, but was all sort of coming together with forks over knives, being in production. And so I connected to that. Many years later, or not that many years later, I went to a conference, the first International Plant-Based Nutrition Healthcare Conference, and there was Neil Barnard speaking at Caldwell Esselstyn and T. Colin Campbell. I've been to those conferences nearly every year since, but they moved it up a level where I then began to understand that, we were not just preventing and maybe treating some heart disease, but just how profound across so many diseases this, whole foods, plant-based nutrition was. And jumping back to medical school, when I learned about the link with artery disease and nutrition and physical activity, can't forget those other lifestyle factors. Every time we came up with looked at a new disease in the course, whether it was breast cancer, prostate cancer, rheumatoid arthritis, diabetes, I was interested. Is this a universal random disease? Time and time again, it was the same dietary lifestyle factors that were strongly implicated in that disease. When lifestyle medicine became a thing, before 2020, I then went on and did my board certification in lifestyle medicine.
Well, my inspiration for adopting a plant-based diet was meeting Malcolm back in 2008. At that time in my life, I've been working for several decades as a librarian at a university library, and I worked with faculty that taught nutrition, and I thought I knew everything I needed to know. I was, ordering the books, doing the literature searches, and so it took me a while to get my head around Malcolm's dietary needs. I had said to him, well, I'm sort of semi-vegetarian in that I couldn't care less about eating meat, but hey, what's a meal without cheese and eggs? So it took me a while to get my head around it. And it was actually in our first year, we'd been known each other nearly a year, when I was just sharing with him my fear of breast cancer. My mother had had a diagnosis, and I just was a bit rattled by that all. And he showed me a chart and said, well, you could cut the dairy in countries of the world where they have, lower animal food intake, lower incidence of breast cancer. And I kind of went, And we lived in different cities in our first few years together. I lived in Melbourne and Malcolm in Adelaide. So I was in Adelaide when he was telling me that. I flew back to Melbourne the next morning, went straight to work, and went and grabbed that book off the shelf that it turned out I'd ordered a couple of years earlier. And that was the China study. And I started reading that very night. And by the time I got to chapter 3, I thought, I get it now. I get it. I've got to stop the dairy. I've got to stop the eggs. And so that, my journey from then, of course, after reading the China study, it was, why didn't I know this? Why don't all the people that I work with know this? I just didn't get that. So it just set me on an endless quest for information, and resulted in me. I did, the eCornell plant-based nutrition certificate, and the McDougall starch solution certificate. Then I decided to go back and study nutrition formally at university, and did a graduate certificate in human nutrition. And by then I was ready to set foot outside the library. So I threw in my day job and started with Malcolm running programs. And we used to run one-day seminars. They got scotched with COVID because we here in Melbourne, Australia, we were in lockdown for more time than most of the world. And so we started running webinars. We converted our one-day seminar into a 4-part webinar, and that worked pretty well. I think in the first year we did them every month when there was such an appetite for online learning. And we also, since 2017, we've been running 6 and then now 7-day immersion retreats. We've modelled them a little bit on what happens in the US, but we've been running about 2 of those each year for the last few years. And we will come back to that. We get so much satisfaction out of running those retreats. That's sort of my story. Yeah.
And you're sticking to it. What are some of the key benefits of a plant-based diet that you typically saw in your patients and your clients?
I guess you could start off just looking at the biomarkers. Improvements in blood cholesterol, like if they really do it, you'll often see, particularly those patients with, the majority just with moderately high cholesterol levels, you'll often see it come down by like 25 to 30%, like the sort of falls that you'd expect to see a statin. It used to be funny in my previous practice. And look, I moved to Melbourne, joined a small practice here in Melbourne. Most of my patients are not plant-based. Some of them will look really puzzled at my bookshelf, how not to die, huh? And then I'd have quite a few vegan patients just wanting to see people for checkups and not be told they needed to eat meat. And people who had found whole foods plant-based. But yeah, the biomarkers, you often see big changes in that. And people's weight comes down. And I guess, A lot of the people I see as patients who are, doing whole foods, plant-based, it wasn't the very beginning. Like there were a few who I've sort of put onto it, but often people have sort of seen it and then decided to seek you out and Google whole foods, plant-based doctors and come and see me. Where we see the most remarkable changes is in our live-in event because, it's 100% at our immersion event. In less than 7 days, we'll see, people will come in and go on, and I'll put a blood pressure machine out there and they'll come in and, it's a little bit high, it's a little bit high, and it'll start to go down through the week. Or we've had a couple of people on insulin where I've had to sort of reduce the dose like to half within the first couple of days. Otherwise, it becomes too strong for them. But I think other than the biomarkers, sometimes it's a sort of improved quality of life or transformation of life. I do remember one middle-aged man who ran a small business and he had some people working for him out in the workshop and he was at the front desk and customers had come in and the telephone would ring. And he said to me, look, since I've been doing whole foods plant-based, I find my work much less stressful because it's sort of like I'm sharper in my brain and more able to sort of multitask between all these things at once. So that's sort of a quality of life thing that's a bit harder to measure.
And just picking up on what he said about the immersion, we get a mixture of people coming in, and some of them are actually very experienced with whole food plant-based. They've been doing it for a while, and they just thought, treat myself to, spending 7 days with a group of people and eating the food and, maybe learn something along the way. And it's from some of those people that it's been the most miraculous changes that they had no expectation. They thought they were already doing it really well. And, just things like we encourage eating leafy greens even for breakfast. We don't quite do the 6 times a day that Esselstyn recommends, but if someone wanted to do 6 times a day, they've only got to stash away some from breakfast time and have it morning tea and they can do it. And so, reduction in pain. So again, even people already eating a good quality plant-based diet will say, my foot pain's gone away, my hands improved. So just wonderful. So pain relief is one of the things we see the most when people do it 100%, such as when we've locked them up for a week and they have no choice unless they've stashed some junk food in their rooms. So that's
And it's not just the food. When you're at the immersion event, we might have a dozen people, and we find that a group dynamic develops very quickly. And sometimes we sort of almost need to just sit back and let them educate and coach each other. But you see, we also have the lifestyle side. We have a walk around we go for walks around a 1 mile track around the property. And if anyone's thinking of coming from the US, our immersion events, we have kangaroos.
Many of them.
Many of them.
You just walk for 1 minute away from the centre and you'll be greeted with kangaroos staring at you.
So we have a personal trainer and functional aging expert come in and give them this inspiring talk about where their life trajectory is taking them and the health span versus lifespan. And commonly we hear back, with our alumni and when I do consultations that, yes, I've taken up some strength training. People in their 60s or 70s will take up strength training because they've been inspired. And, we're also trying to make time so that, they can get to bed and get a reasonable sleep. And the Brahma Kumaris actually run the centre. They provide meditation sessions. So, all those domains of lifestyle medicine, including other ones that aren't in the big 6, like, getting out in nature. The whole place that we hold the immersion at now sort of has a really peaceful sort of vibe to it. We do say that if you really want to thrive, lifestyle medicine's not just about disease. It's about really thriving, having the health and vitality to do those things that are meaningful to you. And we talk about the combination lock of the domains of lifestyle medicine. That is, you can't completely neglect social interaction or sleep or any of those domains and expect to truly thrive. But we would say that nutrition is the keystone. If you get the nutrition right, often other things will fall into place. You'll sleep better, your mood will be better, you'll feel more energy for exercise. And we're very big on the exercise part because I think that is absolutely critical for human health and metabolic health to do quite a lot of physical activity.
And for maintaining independence as you age, very important.
Well, I think for me, that's one of the biggest things I worry about is, dementia and losing who I am, and just ending up in the nursing home. You just don't wake up with dementia, you there's a reason. So I
Well,
want
and
to,
you don't wake up one day and find that you're not strong enough to comfortably get out of a chair. That comes up on you very slowly.
right? Well, what are some of the common misconceptions people have about a plant-based diet?
Oh boy, here in Australia, there's so much industry pushback, like those, meat, dairy, egg industries are really winning. Not a week goes by, almost not a day, where there's not something in the newspaper about, how beneficial it is to eat this protein. And, oh yes, you can do vegan, vegetarian diets, but you'd better be careful. I think the nutrition in Australia, probably in the world, very much, nutrient focused and very much deficiency focused. And I could spend all my time, trying to counteract and push back against these large organizations where McDougall once said, they've got the money, but we've got the truth. But I prefer to focus on the positive. And so we make it our mission to provide education and to support for those people who have, who are doing or have caught a glimpse of the sort of whole foods, plant-based lifestyle and would like our help and support and our information. And we'll continue to support them. They don't have to do it 100%. We'll still support them.
A lot of the work we do is actually helping people work their way through the confusion. And so even within the plant-based world, people are confused about, how much of this and do I have to have that? And it's overwhelming. So, it's a lot of the work I do with people, including I do follow-up coaching. I do coaching groups for people that have done our programs. One of the other things about a common misconception is, the thinking that I've just, if I eat whole food plant-based, that I'm invincible, that it's a cure-all for everything. And, we're very realistic in saying it's about, doing your best, reducing your risk. And I think I recently heard Columbus Batiste say, a cardiologist, that, it's not about no risk, it's about reducing your risk. And so we do need, the other domains of lifestyle medicine are really important in this space. You can't neglect, particularly anxiety, poor sleep and lack of activity.
Yeah, I mean, depression and social isolation are, right up there as big heart risk factors, for example. Okay, doc, I want to stop my thyroid medicines. I'm here to see you to get off my thyroid meds. Now, I know there are cases where people have, where people's Hashimoto's, hypothyroidism has recovered, but most of the time it doesn't. And yeah. I thought I'd better add that
I'm one
sometimes
of
it
them.
does. But it's like I don't want people to, stay severely thyroid deficient for 2 years while they try and do their reversal. Just like I don't want people to have extremely high blood pressure, in the lead up and think, oh, and eventually this whole foods plant-based will bring those blood sugars or that blood pressure down. While those conditions are still out of control, I want them to take the medications. And then when their health starts to improve and I see that blood pressure tracking down, 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 I'll take them off medicine. It might jump up a bit. It'll go down, down, down. I'll take them off another one. I think people need to understand too that conventional medical treatment and whole foods plant-based diet and lifestyle can work hand in hand. It doesn't have to be one or the other. Although, as I say to people, sometimes the whole foods plant-based is so powerful that I'm going to have to take you off those medications because they'll become too strong for you.
It's so true. And I love the misconception about like, oh, I'm plant-based, I'm bulletproof now. No, you are not. So, well, how do you recommend transitioning to a plant-based diet for someone who's new to this?
In telling them what to eat, we really emphasize the importance of eating enough. I give a talk on calorie density in any of the programs we run. To us, that's the absolute core. You need to understand calorie density in order to be able to plate up, your breakfast, your lunch, and your dinner, and to know the impact of those little snacks on the side and whatnot. And for some people, they're not eating enough, particularly, say, someone with high energy needs. You often see if a couple start eating whole food plant-based, the guy, if he's reasonably athletic, feels like he's not thriving because he's just not getting enough to eat. So they haven't understood, taking that slab of fish or whatever it is off the plate, you've got to eat twice the volume of the grains and the legumes to replace that. So that's a real key. And sometimes people can lose weight too rapidly.
And I think if I'm seeing, if I have a patient and they're in fairly early stages and they've just recently made the transition, and then I do a follow-up consultation. I did mention early on, so beginning early last year, I actually quit my clinic job, and now I just practice, lifestyle medicine, particular emphasis on whole foods, plant-based nutrition. That's all I do. And most of that's done by telehealth. And fortunately for me, we have a national registration. So I see people only in Australia who are in Australia. Anyone in Australia I can provide a telehealth consultation to. And I do a few in-persons out of this home office here. But if I'm seeing that patient who's made the recent transition and they're very happy because, they've lost so many kilos in the first month, I'm actually concerned because I'm thinking maybe you don't quite get it. Maybe you're just trying to live on vegetables and salads. Maybe they don't understand that half the plate needs to be, the starches, the whole grains, the legumes, the starchy vegetables.
Run programs based around the why, the what, and the how. So, having their why, and we, talk about the science and how, the evidence and how strong it is for eating whole food plant-based diet, but also their own why. They need to think about that because how much are they going to change? How much do they want to change? And all of those things. And then the what, it's around what to eat. And we talk about 4 key food groups: the grains, the beans, the vegetables and fruit. And then, give them examples of plating up, talk about calorie density. And then the how is, around it's not just, getting the right tools and buying the right foods, although label reading is very important in that, and we talk about that. But it's also how to navigate being different, being the only one in your community who's going in this direction. And so again, we provide a lot of support around that. We run a healthy community potluck group in Melbourne. People really value being able to connect with others so that they don't feel quite so mad.
Oh, it's so true. And we have Plant-Based Cape Con here. We are also part of the Building Healthy Communities, which is lovely, that we've got PCRM running this now and connecting us. So it's awesome because you do feel isolated and there is that big impact of community. Some essential nutrients to pay attention to in the plant-based diet.
Well, everyone is so worried about where they're going to get the protein from.
Oh my God.
You're a middle-aged woman and you're getting enough calcium. They're all worried about those. And I just say, if there's one nutrient you should be worried about, it's fiber. Where are you getting your fiber from? How much fiber? Even people eating plant-based, sometimes they're a bit leery of the grains and they sort of think, oh, I'm getting a lot of fiber. And you actually don't get, yes, vegetables and fruit are full of fiber, but because they're low calorie density, you're actually not getting that many grams of fiber just from those alone. And you need the important fibers that are in, the legumes and the whole grains. And this concept of, they think, well, I'm getting, I'm eating my oats for breakfast, I'm getting some. But if people are still eating highly processed foods, oils, and, even though people might learn to not cook with oil at home, if they eat out, they're still getting a lot of oil. They don't realize the displacement aspect of if, you think, well, everything I eat's got fiber in it. Well, no, not if you're eating refined grains, not if you're eating oils. So displacement's a really important concept to understand.
And that concept is Like, if you eat those tablespoons of olive oil or you eat white pasta, you didn't notice it was white pasta, you're eating, or you eat a protein powder, you're eating hundreds and hundreds of calories that have had nutrients stripped away from them. And the displacement is if you hadn't eaten those, then in your daily 2,000 calories, or if you like me, 3,000 calories of food, you'll eat that many calories less of the food that actually has the nutrients in them.
Or you're just going to eat too many calories if you if you are magically able to eat all of your calories from whole food plant-based, and then you add in the calorie dilute things. And so one of the things that's really important, we do teach calorie density and say that's really the main, the numbers you've got to understand. However, food tracking can be a little bit useful as a reality check for people. Not that they should be tracking what they're eating, every day, but just to get an idea how they're tracking in overall calorie intake. Are they meeting their nutrient needs? So there's a couple of, there's some a few things to be conscious of. And so, if people are worried about getting enough iron, most people then will think, oh, what are the foods high in iron? And we say, no, it's about, eating foods that are not depleted in those nutrients. That's the first thing if someone's trying to get, an increase in a particular nutrient. So, we don't focus on any one of these. When we talk about calcium, it's like, no, you don't have to, we don't talk in terms of one food owning one nutrient. Like
Industry loves that.
You don't have to be guzzling plant milk to, fortified plant milk to get enough calcium. It's in all your food. So long as you're not, having a quarter of your day's calories from something that's got no calcium, like oil.
Look at nutrients per weight of food. And of course, food that's super concentrated, really high in calories, dry, like sesame seeds look really high in calcium and pumpkin seeds look really high in protein. But if you actually look at it per calorie, they're really not ahead of the other whole plant foods, for example. People want to measure their nutrient levels. Doc, I want you to measure all my nutrients, make sure I'm getting enough. And it's like, truth is, I can't actually do that. And I know there are lots of people, sort of the alternative and other practitioners who think they can, but not many nutrients can be measured accurately and reliably. Like you can measure iron and you can get a reasonable measurement of someone's, iron status, but then you measure zinc. And the blood zinc levels does a very poor job in classifying an individual as being adequate or inadequate. And then there are things like, am I getting enough iodine? And you can do a urinary iodine, but that's more reflective of your recent iodine intake rather than telling you how much the thyroid's got stored. I do measure vitamin B12 sort of routinely. The only people that ever low are people who are not plant-based, so it's low for other reasons. Was more common in my practice, or people who are plant-based and don't take it or rarely take B12. So when it comes to supplements, I recommend that, everyone who's very plant predominant takes some B12 because, we're not exposed to it in nature. Like it's in the dirt, it's in the dirty water, it's in the dirt on the food and the slime on the fruit that doesn't enter my mouth. Plus or minus D, depending on, where you live and your amount of sun exposure. It's pretty dim and dark, and we're in the shortest days of the year here.
So, what advice do you have for managing cravings for non-plant-based foods? Because, like, they still run in my brain, like, a lot. And even though I've been plant-based for a long time, they're still there.
So, in terms of helping people manage cravings, we draw heavily on the work of psychologist Doug Lisle. He's got some excellent presentations in the book co-authored with Alan Goldhammer, The Pleasure Trap. So we talk about that in our programs. And I think that explaining to people what the pleasure trap is can help people at least then have it on their radar, that when I'm, suddenly finding that I'm smashing in these potato crisps or chocolate or whatever it is, It's human evolution. People are drawn to the richest food in their environment. One of the keys is don't have it in your environment, like clear it out of your house. But that still doesn't stop, if someone's called in to pay for their petrol, their gas, and there's the chocolates right by the cash register, and so there's still that temptation. And so there's quite a bit of work to be done around understanding just what is your enemy there, and then having some techniques for being able to manage. And it's not just about never doing it, it's about being kind to yourself, that you're going to find yourself at times in these environments eating rich food that you're planning not to.
I remember earlier in our relationship when we were in different cities, and Jenny would go back to work and there'd be morning tea, and it was always someone's birthday or something, in a bigger workplace. And then there was the cafe with those, apparently delicious treats and things. But you had that strategy where you tell yourself, look, I'll eat the banana first, and then I'll think about whether I have the little treat.
Yeah. And in the coaching groups that I run, I explain to people that if you found yourself eating something that you were hoping, to avoid, it's like, don't beat yourself up, but actually swiftly follow with nutritious food. And I give an example of someone recently that said to me, well, I ate whatever it was. And so, I didn't eat dinner that night because I knew I'd had too many calories. And I said, aha, what would have been best for your body is to steam up a huge plate of vegetables and smash those in, even if you're not really hungry, because your brains are telling you, I've had calories. But you actually need those, phytonutrient rich, low calorie density foods to kind of counteract the damage that, something that's high in, salt and oil and sugar could be doing to your body. So it's that thing of don't beat yourself up, just add in, eat more of something that's lower calorie density, that's going to at least partly compensate the damage that you've done. But we acknowledge it's a big problem, and I think one of the best talks I've ever heard from Dr. Doug Lisle is the cram circuit. It's not just the pleasure trap. It's like, there's 3 or 4 things you've got to be mindful of. It's tricky, but we reassure people that it's normal, because it's very easy for someone to get well into eating whole food plant-based, and then something happens like Christmas and they go off the rails, and then they feel shame, and then they think, oh, I can't even, I can't go to the next potluck because I've put on weight and I'm feeling ashamed. So it's like, it's so normal.
So at our immersion, live-in events, we do a lot of work on the behaviour change. And we sort of do some workshops where they break into small groups about, they might talk about, the barriers and the strategies and things that will help them survive out in the wild.
The age-old question, and I've heard this question so many times, how can I ensure that I'm getting enough protein in a plant-based diet?
Yeah, interesting. When someone goes, where are you going to get your protein from then? It's like, I like the answer, Doug Lisle's answer, I don't know. Or just seems to be working. I'm doing this for a while. My doctor said it'll be all right. But no, in the whole foods plant-based world, people just say, just eat whole plant foods. This is about 12% of calories from protein, probably in a pretty average sort of plant-based diet. But then they add on, if they're a little bit more nuanced, they'll say, just eat enough calories of a variety of whole plant foods and you'll get enough protein. And that's true. You'll easily meet the recommended intake, not just the minimum. You'll most likely exceed that. However, you see a lot of people who are not meeting their calorie needs because they've got an extra 20, 30, 50 pounds, whatever, of weight. So they're going to spend several months. Maybe if they need 2,000 calories, they'll only be eating 1,200, or a larger male might only be eating 1,600. So they're not meeting their calorie needs. Now, I actually calculated that on a sort of reduced calorie intake like that, you probably need to have about 16% of calories from protein. So that's a situation where you might have to sort of think about it and go, yeah, better make sure I have plenty of legumes in my day. I'll choose the higher protein grains like, wheat and oats over rice. So yeah, people might actually have to think a little bit about tipping the balance towards some of the higher protein whole plant foods.
Well, what are some things that people can do to start this journey?
I like to begin with their why. Why are they doing this?
And this is not just people will go live long and prosper. And it's no, don't just tell me your why is because you want to live a long time and be healthy. The why is deeper than that. Like me, I identify as an active person, or I want to be here for my grandchildren, or I work with my church, or I support people and I'm on a mission to help people improve their health and do whole foods plant-based. So I think the why needs to be sort of something more personally meaningful than just live a long time and be healthy.
We say focus on adding in. Don't be so sort of thinking about, oh, I can't eat this and I can't eat that. Focus on what are the foods that you can eat and add them in and crowd the other foods off the plate. And with that actually comes focus on making sure you're eating enough. Because the other side, Malcolm mentioned about you might not be, getting enough protein if you're having, too fewer calories in a day, but it's having too few calories in a day, which makes you far more vulnerable to that snacking of the calorie rich and processed foods. So it's like just focus on, having, more vegetables, add some, if you're still going to be eating some meat, add some grains, add some beans, make that, bolognese sauce with, adding lentils. So focus on adding in so it's more in a positive and not to be overwhelmed by all the things that you can't eat. Over time, you'll tweak that. So, most people do take a while to transition, and we're not expecting perfection, overnight, within a week. Find support in some way, connect in your community. If you've got, whether it's through online groups or a local meetup group, or even just, connecting to one or two others who are doing on this journey can be really, really helpful. So I think they're our sort of three things.
And even as people who work in this area and have quite a lot of knowledge in it, we sort of need our support. Otherwise, we feel like some sort of, marginal, delusional little group that's, losing the nutrition war and sticking to some ancient tradition that, doesn't hold true. So, I'm a member of the American College of Lifestyle Medicine. I'm a member of the Australian one as well, but the American one, so it keeps sending me stuff about plant-based nutrition, and we go to the Plantrition conference, and we've got some close friends and the organisation Doctors for Nutrition, which is a whole foods plant-based group in Australia.
And we go to, we've started, put our names down, and we've done one of the National Health Association cruises, and just to, we've travelled across the world a number of times for just to connect, to hang out with people who are on the same journey is really important.
To reboot our enthusiasm, in a world, in a country that's moving really rapidly away from whole foods plant-based.
Don't get stuck in the cracks. Don't confuse yourself by trying to follow too many different plant-based experts. It's like sometimes it's easier just to follow one person and the simplicity of it, and know that, a huge percentage of your health comes from, just eating some simple foods, and not to be too worried about, all of those nuances that can go into a whole food plant-based diet. Just make sure you're eating beans and grains and fruit and veg and small amounts of nuts and seeds, not too crazy on those, and you'll do well.
And if it has to be non-organic kale and canned beans, you're going to get 99% of the benefit from having those without necessarily going to the, organic or cooking everything from scratch.
No, and I will add one piece to your comments is to make sure you clean your house out. Because if it's in your house, it's in your mouth, you know. And yeah, being that food addict, because like I'm basically lazy. So for me to go get a cookie, I have to get in my car and drive like 5 miles to get a cookie. So by that time, I'm like, yeah, no, I'm going to make something in the kitchen. So it just makes it. But thank you so much for sharing your insights and thoughts on plant-based living. So
Thank you very much for having us on your channel. It's been lovely to get to know you.
Thank you, Jean. And USA, we'll see you in September.
I look forward to that.